the following. 3 participants are in the conference.
AV room.
Ron Gould.
Supervisor Johnson.
Hildy Angus has joined the conference.
Okay, good afternoon, everyone. This is the special meeting for April the 10th. And Jenny, can you do a roll call and see who's on the phone with us?
Supervisor Johnson?
I'm here.
Supervisor Gould?
Here.
Supervisor Angus?
Here.
Supervisor Watson?
President, thank you.
And Chairman Bishop, we have a quorum.
Okay, thank you very much. So just as a formality, I need to let you know the Board of Supervisors may by motion recess into executive session to receive legal advice from the board's attorney on any item contained within this agenda pursuant to ARS. So the only thing on the agenda today is a discussion of possible action, reference a update on the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19, and taking any necessary actions based upon the updates. So Denise, I'll turn the floor over to you.
Wonderful. Thank you. Good afternoon, Supervisor Bishop, Chairman Bishop, and board members. I just wanted to give you an update on what our activities have been in the last couple of days, and then I open for questions. I think you've all received the hospital report, and you get that each morning. What we see there is that we still have capacity, which is great because we haven't reached our curve, the top of our curve yet, and that's what we're hoping to keep that capacity available to address those concerns that we would have when we reach the top of that curve in patient levels. And our patient count has slowed down a little bit. It went up the first part of the week, but just recently we had a day off basically of no positive cases, so that's a good sign. I'm not sure that I would say that's a sign of things to come, but I do want to say that's always a nice thing to see when we don't have positive cases coming in the door. Some other updates, there are going to be some additions made to the ADHS website in their dashboard, so I wanted to provide those to you. I don't have a lot of detail, they just ran through these very, very quickly with us, so they will all roll out on Sunday, this coming Sunday, so if you have questions on Monday, I'll try to have an answer for you by then. So additional data will be race and ethnicity of the cases. There'll be a case count by zip code, but keep in mind, my understanding of this is that case count will not begin until we hit 10 within a zip code area. That seems to be our threshold, really, for adding data into and making it more granular to us and to the public.
Makes sense.
There will be a PPE supplies distributed tab that'll be state level, so it won't be broken down by county. And then long-term care outbreaks by county. So that will be something that you will see in addition. And there may be some additions on the death records side of it and some of the demographic information there. But again, I don't think you will see that data for us, just as you don't now. You don't see our 2 cases because we haven't reached 10 yet. If you reach 10 in any of those categories, then they'll begin to report it out in greater detail. Additionally, we're moving forward with the isolation and quarantine site out at the fairgrounds. We're still collecting the costs associated with that, and that's important for us to gather. And then we would like to present that to Mike and possibly the board to review that before we move forward with any kind of changes. We're also working on the logistics of this, of course, which means the staffing, what kind of paperwork and intake forms need to be completed on each person that enters the facility, what are the rules around the facility, what kind of security is needed, what do we need for food. There's a lot of pieces to that activity that we need to still continue to resolve. What we also learned yesterday through our local health officer call is that many of the homeless shelters throughout the state will be eligible for grant funding for motel vouchers for individuals that may be either a suspect case or a potential positive case, so that they can isolate, quarantine themselves in that manner. Those vouchers are good for up to 2 months. Of course, they're really only needed for approximately 2 weeks, maybe slightly longer here and there. But that's another option available to communities to pursue, or at least the homeless shelters. It's only open to those that are eligible for homeless shelter funding. But at least it's another avenue that we could pursue, and that's important for other communities to look into. Other than that, you notice that we purchased the PPE. It's really just the 3-ply surgical masks. Those are not N95 masks. And we were able to collaborate with the 4 local hospitals to try to get the best pricing. And so they will be purchasing 100,000 of those and just basically reimbursing the county for 100,000 each of those masks, up to 400,000. And I probably didn't state that very clearly. So each hospital will be purchasing 100,000 of those masks at the cost that we've agreed to and what the vendor has provided to us. And then we'll retain 100,000 of those, and we require agencies that are requesting supplies from us to submit a resource request form. And we evaluate those forms to ensure that we can provide out what we need to those agencies, but also we want to make sure that we have enough, again, as I've mentioned before, in our supply to allow us to continue for another probably 4 to 6 weeks, 4 to 5 weeks of filling that gap that's going to be out in the community until that supply chain can be refilled. Which we're starting to get information about more vendors available. The concern, of course, always is that there are a lot of scams out there. And we need to be, each of these vendors needs to be vetted properly before we move forward with any purchases. This is really important for all agencies to consider. So that's sort of a summary of my last couple of days, but I'm open to questions and try to answer those for everybody.
Okay, thank you. Supervisor Watson, do you have anything?
Yes, I do. Thank you. Well, I noticed that the Kingman Regional Hospital has done a lot more testing than the other facilities around Mojave County. Is there a reason for that?
Well, they've been able to secure those additional testing supplies, and I don't know if that's because they had them on hand prior to the event or whether or not they have been able to secure them from other sources. I haven't actually asked that question, but I'm happy to ask and learn that information for you.
If they have an ample supply on hand, they may want to do a little cooperative agreements with the cohorts throughout the community. Just a suggestion. Another question I had is, when I was reviewing the statistics this morning, I noticed that there's a larger percentage of females. Is there a reason for that?
I have not been given any reasons, nor has there been any reasons provided by the Arizona Department of Health Services for that. So at this point, it would be speculation about what the cause would be. I'll continue asking that question, though, to see if they have any additional data that they can provide us.
And my last question probably will be unanswerable also. But I did notice in reviewing all the statewide statistics that the Native American population seems to be more at risk than others, and that I suppose might be a genetic makeup situation.
Well, they have a lot of underlying medical conditions in many areas of the reservation. They have very limited access to care If you look, for example, on the Navajo Nation, I'm sure you're aware that they've got Tuba City Regional Medical Center, Chinle Regional Medical Center, and I'm not sure if they have an actual hospital in Window Rock. But to travel to any of those sites, they usually do not seek care immediately. And so it allows for those symptoms to progress, and by the time they're reaching the hospital, they are very sick.
Yeah.
They do have regional clinics in many of these chapters on the Navajo Nation, and those can help, but oftentimes, again, those are 20, 30 miles away.
Yeah, my concern is basically our Wallapai Indian Nation and concern there, but I did notice that the possibility of the Native Americans being subjected to this particular virus is a large number of those folks have a type 2 diabetes, and that might be also another trigger.
Yes, that is one of the underlying chronic conditions that can basically make these people at higher risk for severe health conditions as a result of COVID-19.
Thank you very much.
Certainly. Oh, speaking of testing, if I could circle back to that really quick. Supervisor Bishop, your assistant, executive assistant gave me a question about where the Walgreens clinics will be.
Yes.
And I did learn that there are going to be 2 in Arizona at this point. One will be in El Mirage, and one will be in Tucson. I don't know any more information at this point, but apparently there will be 15 stores across multiple states, and Arizona is one of them. So we have 2 stores standing up, drive-through testing in those 2 locations. So as I learn more about how that spreads out and increases, I will also keep you informed of that.
Okay. Thank you for clearing that up. I was going to ask you that, so appreciate it. All right, Supervisor Gold, do you have any questions?
None today, ma'am.
Okay, Supervisor Angus?
Hi there. This is just to go back to what Gary was talking about, Kingman. I haven't had this confirmed. Maybe you could. I heard that Kingman had a lot of tests in the beginning because, of course, they were associated with Mayo, but they were not like the protocol of the state. They were doing it, but it wasn't counted as being correct. Do you know anything about that?
Well, what I know from my conversations with KRMC staff is that they were following the Arizona State Lab testing matrix, and they, as I understand it, they continue to do so. And so that sets the criteria. Now that has changed. Generally, twice a week, we get a new matrix with new testing protocols, basically. And so as that occurs, those hospitals and healthcare providers are also adjusting. Now, the healthcare providers that are using a private lab don't necessarily have to, and actually hospitals for that matter, who are using private lab, don't necessarily have to follow that criteria, but I think due to the limited number of testing supplies available, they're trying to adhere to that to make sure that they're testing appropriately. Did that answer your question, Supervisor Angus?
Yeah, and so to look at on our website, the county test results, we have test performed 434, negative 377, and pending 57. So if the percentages go, then we're not going to have a handful of new cases. How come there's just a few pending? Have we not been doing ongoing testing?
Well, I think, again, the testing criteria is relatively strict, and testing supplies still are considered in a shortage place, and so you're not seeing that expanded testing out in the community where your numbers of pending may go up. But the good news is on that light is that the other side of that is that we were having a delay in getting test results back, and that's not the county getting a delay per se, because the state lab has been very quick. But I believe the commercial private labs were overwhelmed with the demand immediately out of the gate. And so they were taking anywhere from generally 3 days, but all the way up to 10 days to get results back to providers and hospitals. And that delay means people stay home, quarantined, until we get those results back and can follow through.
By this, can we deduce from this that people are really paying attention, and even if they're feeling bad, they're not running to the hospital? What I'm hearing is, the hospitals are pretty empty because they're not doing their elective surgeries. There's a whole other issue around the country, but so we're not seeing what we thought we would see at this time. Not saying it's not going to happen, but we thought if we followed the models, we were going to see a lot more in-hospital patients.
That's correct. That's correct. And I think your point was well made, though, that we can't predict the future, and knowing that as you look at the spread of how it's occurred throughout the state, it started in the very central part of the state and it's spreading outwards. And that's been the trend so far, so we clearly should not consider ourselves out of the woods yet, and I think we need to be mindful of the fact that things could change very quickly. Even without those test results, we do know that individuals could still be hospitalized as a result of COVID-related symptoms, but the test may not be completed, but they may still have those symptoms available. So, and that could change very rapidly, their case counts, their census.
I have one more question. Mm-hmm. So our cases that are connected to each other, mm-hmm. which seems to be a lot in our case, does that go with the national average?
That's a very good question. Let me look into that, okay?
Okay, thank you.
Sure.
Hey, Supervisor Johnson.
Thank you, Madam Chair. I have a few questions. The first one is listening to your mayor's conference call. Have the river cities or the lake cities requested in writing the county's help in control or restricting lake and river access?
I have received a phone, not in writing, no. Let me step back. I have not received any requests for that in writing.
Okay. On the hospital reports that we get, it's my understanding that some of those numbers were 2 days, some of those numbers were 2 weeks behind, which obviously isn't what we want to be receiving. Has that been corrected?
It has, yes. At the very bottom of the page, it shows last reported. Hospitals are required to report that data every day, and what they have asked us to do is if we find that that is not occurring, because we're reviewing these numbers daily, to notify them immediately. And I did get requests from all of the hospital CEOs to basically send them an email, call them, text them, let them know we're not receiving the information or it's not being entered into the systems, and then they will make sure that it happens.
All right. In the event of needed space for patients, do we have the location, the equipment, the staffing in place?
I'm sorry, could you repeat that question, Supervisor Johnson? I don't think I caught the first part of it.
In the event that we have to start holding patients outside of the hospitals, do we have the space available, the staffing, the equipment?
I see. Each of the hospitals has been asked to increase their capacity by 50%, and they're also required to have surge plans for these types of events. And so in our case, the hospitals are working towards meeting that requirement, which is not due until April 24th. Additionally, what is happening at the state level is they are looking at regional alternate care centers, alternate care sites. So if you hear ACS, that's what that is. Those particular sites are going to be in, likely, I should say, I believe they've made decisions, but I won't speak for them. But they were looking at sites in Flagstaff, Phoenix, and Tucson. Those would be for individuals who didn't require, they were not high acuity patients, and they could be outside in a lower acuity setting these are going to be very large sites when they're actually brought up to speed. You're looking at the St. Luke's site, which is what they're looking at right now, is taking the old St. Luke's Hospital and renovating it. That will start off with 400-plus beds and move up from there. I believe the site that they're looking at in Flagstaff is about 1,000-bed space. Again, scalable based on what their needs are at that time. And then I believe they have another one in Tucson that they're considering. So in those cases, some of those patients, to accommodate higher acuity patients staying in the hospital, may need to go to some of those sites if we find that that's a need.
Okay, and so then we would transport those people to that location. What I was worried about was seeing other states having problems with red tape getting patients transferred to other facilities, but if it's a state-run and state-authorized facility, I'm guessing we won't have that red tape in Arizona.
Well, I don't believe so, but let me check into that for you, please, okay?
All right, thank you. That's all I have, Madam Chair.
Okay. Anybody else? Mr. Hendricks? Okay, I would like to know if, when we hit this mark of 10 people that are affected, will we be getting numbers of those that have recovered?
That question's been brought up more times, and I thank you for allowing me time to clear that up. The state doesn't even address that. They don't, and we don't have a way to collect that information. It's not reported to us in any way. So I know I've seen it out in the media, and I've seen it kind of mentioned in several different posts, but at this point, the state has no plans to post that, and I'm not sure where they would even get that data.
Okay, so I guess we're safe to assume that people are recovering because the death numbers aren't going up. So, you have to assume that 2 weeks after it's been confirmed, it's probably a recovery then.
Mm-hmm. Mm-hmm.
Okay, and then lastly, is there anything that this board can do to help you and your staff in any way? And if there is, at any time, please reach out to us.
I will certainly do that. I think, we want to direct everybody to our website for information. That's really important because we're using CDC and ADHS as the basis of that, in addition to our EPIs who are doing the work, I should say epidemiologist, who is helping us collect that data. Mm-hmm. But we want people to get to the correct, accurate information, and that's where we're trying to post it. So any help you can give us in getting people directed to that site to get the most up-to-date information would be greatly appreciated.
Okay, yeah, the website looks really good. A lot of information. I like the graphs and the way it's been presented, so thank you.
Good. Absolutely.
Okay, there's no other...
Madam Chair?
Supervisor Johnson.
Thank you. Who is this epidemiologist that we have that's working with us?
That's Anna Scherzer. She's our department epidemiologist.
All right, thank you.
Mm-hmm, certainly.
Okay, there's no further discussion. I'll adjourn the meeting.
Hildy Angus.